Hi, my name is Tracy Krieger, and this is my presentation on Charcot-Marie-Tooth disease, otherwise known as CMT. What is CMT? CMT is a progressive disorder. There's several levels of them, so it's a group of them that affects the peripheral nerves. The peripheral nerves are what tells you when you touch something, if it's hot, cold, rough, if you're in pain. And these peripheral nerves that it affects are the ones that connect the brain and the spinal cord to the muscles throughout the body. Once these nerves get damaged, and most of the time they affect the feet first, they can progress up the legs to the hands, but they'll lose sensation. You may not be able to hold on to something. You may like the grasping of stuff. My ex-husband had this disease. I would have to test the water for him because he would never be able to tell when he put his foot in the bathtub if it was too hot or too cold, because he lost that sensation in his feet. Some of the symptoms are, they usually start out with balancing issues. They may be extra clumsy, and eventually progress to where the feet have deformities. They'll also have trouble flexing their feet. Their Achilles tendon may be shortened because of the disease. And eventually it will affect the muscles in the leg, and then the person will have to be in a wheelchair. And then it also, like I said, can progress up to the hands and the arms. So who's affected by CMT? Basically, it's a primarily genetic disease that's inherited from your parents. It's usually detected in early adulthood or adolescence. There's some cases documented with no family history, and some people walk around with it and never even know they have it because their symptoms are so mild. So when we talk about the distribution of CMT, if you look at the United States, I found the statistics that 40 people out of every 100,000 have CMT. In Japan, it's said to be roughly 11 people per 100,000. In Italy, it's roughly 17.5 have it. And in Spain, it's approximately 28 people in every 100,000. And I did find a little map down there, how it's distributed through the United States. So when we think about a descriptive epidemiology, I still cannot say that word, we talk about the person, because gender plays a huge role in CMT. When you look at the first two levels, CMT1 and CMT2, normally they have one affected parent. And CMT2 and CMT4, you can also have two affected parents. So I know that CMT2 is in both of them. It was kind of a little confusing with the research I did. But with the CMTX, which is the most severe cases, the ones that have a lot of the deformities and the pain, they affect the males worse than the women. And I had found an interesting fact that the fathers cannot pass their genes to their sons, which is really good because I have two boys and my ex-husband actually lost his foot due to this disease. But they will pass it on to their daughters in a milder form. So if a father would have the CMTX, they may pass one of the genes onto the daughter where she may only have like a CMT1. So what's all this mean for healthcare managers? Basically, we need to use this information during the 5 stages of planning. We need to learn how to better diagnose patients. So we can use this information by, if a gentleman has CMT, we can monitor their daughters, or if the mother has it, we can monitor the sons for it to see what's, to fight it early, to catch it early and treat it the way it's supposed to be. And then they can use that information to figure out what is the best way to treat it. With my husband, they waited way too long, and with infections and just the massive amount of deterioration in his foot, they were unable to save it. And we can also look at this information, see what's the best way to support the people who have CMT, and how to inform the public and patients so that they know what to look for. So in my conclusion, I like this little saying down here, a goal without a plan is just a dream. And seeing what it's done to my my ex-husband and my family, the clinical research that they're developing will hopefully allow us to turn that dream into a goal, and we can find a way to hopefully find a cure for this. Thank you.